Well, hello. It looks like you've been laid up. Where does it hurt? Oh, so you hurt your back lifting a patient? Ouch! You're not alone. Over half of caregivers in hospitals, nursing homes, or home healthcare settings have suffered from chronic back pain in the past 6 months. In fact, if that caregiver tries to move you without help or proper equipment, he could wind up in the hospital bed next to you. It's no wonder that patient caregiver ranks in the top 10 most hazardous occupations for injuries to muscles and joints. So, why don't caregivers simply use safe lifting rules while on the job? Well, safe lifting rules don't apply to moving patients. After all, patients are people, and not at all like a box or other heavy object. They are bulky and difficult to hold close to your body. You've probably noticed that patients don't have convenient handles to hold on to, and they can be unpredictable and make sudden moves. Oops. What does work is being smart about lifting. Exactly. A team approach helps share the load, prevent injury, and makes the patient feel more secure. It can be really effective if you're moving a patient a short distance. An even better idea is to use an appropriate lifting device. One made specifically for the type of patient and environment you're working in. Some lifts roll on the floor and work well for patients who need to be moved longer distances or from room to room. Other lifts are mounted to the ceiling, which can support patients more securely, but only go where the track goes. In either case here, lifts support the patient securely with either a sling or a vest. There are even air-assisted lifts, highly portable devices that use compressed air to lift a patient who's fallen into a seated or upright position. When are lift devices the best choice? Whenever possible, but especially when the lift is awkward. Hey, nice picture of you! Sorry, not funny. Awkward positions happen when moving a patient from surfaces of different heights, like a bed to a chair, or a chair to a toilet, for example. Remember, use the device designed for your situation. Get trained on devices, for your sake and your patient's. And if you need help, ask before you lift. Finally, while some caregivers may think that using a lifting device will slow you down, a few extra minutes here or there are certainly worth protecting your health and safety, not to mention the safety of your patient, right? Right. Okay, let's recap. Being a patient caregiver can be hazardous. So, whenever possible, avoid moving patients of any size on your own. Instead, take a team approach, or better yet, use a lifting device. And always ask for help if needed. Your back and your patients will thank you. For more uplifting tips on workplace safety, call Montana State Fund.